Steroids are amazing for stopping a flare, but they can be a disaster for your blood sugar and your waistline. The good news, you can actually use your diet to buffer those side effects of the prednisone. Today, I'm breaking down the steroid diet, the simple dietary changes that can help minimize the side effect of the steroid and also help manage your acute flare of your rheumatoid arthritis. Hello, all of you rheumatoid arthritis warrior. This is Dr. Ananta Subedi, your rheumatoid arthritis guide at the Rheum Doc, as well as a practicing rheumatologist here at Empower Arthritis and Rheumatology Center. Today, I'm helping you learn more about a simple dietary changes that can help you minimize the side effect of steroid. Please stick around. Before I go further, don't forget to like and subscribe to our channel so that you can always get this content, and that can also help other RA warriors get this type of content. And also put some comment so that we can understand what type of content you like and how we can better serve you. And we also have some gifts for you. The number one being the free copy of the Holistic Rheumatoid Arthritis Guidebook, which you can use to help understand about rheumatoid arthritis. And also don't forget to accept the recipe. It contains an anti-inflammatory smoothie that you can prepare every morning so that you can manage your RA better and you don't need to go to those steroids. Now, the first question that might come in your mind is why diet is so important while you are taking steroids. And I have listed 4 important things that will help you understand why diet is so important. And the first one is diet can help decrease those common steroid-related side effects. Proper nutrition that includes bone healthy diet can help make your bones stronger as well as prevent muscle loss, which is a common problem in steroid. As we have discussed in the previous video, steroid can change your fluid balance. Your body retain more fluid. That's why if you can manage fluid and salt intake by your diet, it can also help minimize those side effects. And when you understand these side effects and when you understand these dietary changes, you can better manage those side effects, and even you can prevent those side effects while you are taking steroids. Now, let's start with the bone health. We have talked in the previous video that steroid can weaken your bone and it can increase your risk of osteoporosis, which is basically the weakness in your bone, and increase your risk of fracture. So to minimize that, we can make some dietary changes that I have outlined here that can help prevent those bone weaknesses. And the focus is on adequate calcium and vitamin D. So steroid can help decrease the absorption of both calcium and the vitamin D, causing increasing bone loss. So taking extra supplement calcium can help your bone get enough calcium for building bones. And aim for at least around 1200 milligrams per day of calcium in divided doses. But also check with your doctors on how much calcium do you need per day depending on your overall health. Some of you may not be able to tolerate calcium supplement because of side effects, so always check with your doctor what is the right dose for you. Along with the calcium, vitamin D is also important for our bone health. So when you are taking steroid, taking vitamin D supplement is as important. Some of you RA warriors, if you have osteoporosis, which is bone weakness, these dietary changes will help you, but along with the dietary supplement, your doctor might also add some other medication to protect your bone. So ask your rheumatologist on how you can better protect your bone while you are taking steroids. So the second problem we talked about earlier was unusual fluid retention and then heart health related problem like increased blood pressure. So to minimize those, here are 3 important dietary changes. And the number 1 is limiting sodium. And this will help you minimize fluid retention as well as minimize high blood pressure. The second one is increasing potassium. Steroid can also cause low potassium level. That's why adding diet that is high in potassium might help you maintain your good fluid balance as well as your heart health. And adequate hydration is also important when you are taking the steroids. An important pro tip, there are some of the few fruits and vegetables that are high in potassium, including bananas, avocado, and green leafy vegetables, which are high in potassium, that will help you manage your fluid balance well while you are taking steroids. The next important dietary changes is to support your muscles. As we have discussed previously, steroid can cause muscle loss. That's why it's very important to focus on intake of protein while you are on steroid, and focus on lean protein such as chicken, turkey, and fish, which has good quality protein. If you are vegetarian, then you can also use beans, lentil, and tofu, which has high amount of protein. So also focus on low-fat dairy product and egg that has also high quality protein. Whole grain also have a lot of fiber that will also help support your gut health. And this fiber containing whole grain include oats, quinoa, and brown rice. And always focus on whole wheat rather than the white bread. And these protein containing diet can help prevent muscle loss, which can be a problem in long-term use of steroids. There are certain food that we need to limit, particularly the high sugar and refined carbohydrate. And the reason is we have discussed previously that steroid increase your blood sugar, increasing your risk of diabetes. So minimizing this high sugar and high refined carbohydrate can help minimize high blood sugar as well as diabetes. Many of you might have increased appetite when you are taking steroid. So to minimize excessive use of high sugar containing food, try to keep some snacks that are high in protein, such as protein bars or nuts or vegetables and fruits that can help minimize unusual intake, the increased intake of high carb containing food. The other important dietary changes is adequate hydration. So drink plenty of water when you are taking steroid to minimize dehydration. When you are taking your steroid, always take it with meal or with glass of milk. That can help protect your gut. That can help protect your risk of having gastritis due to steroids. Sometimes it can be overwhelming to manage your rheumatoid arthritis as well as managing the side effects of steroid. So have your team available for you. That includes your rheumatologist and even a dietitian that can help you guide what are the diet good for you and what are the diet that are not good for you while you are taking steroid. So use the advice from your rheumatologist, your primary care doctor, and a dietitian who can guide you better on how you effectively manage your symptoms of side effect with steroids. Making a major dietary changes can be challenging. That's why start small, make small changes, but be consistent with those small changes. So at least do one thing at a time. Start one dietary changes and then add other tools or dietary changes that we have discussed today. That will help you maintain those dietary changes. If you try to do too many things at the same time, it can be overwhelming. You are dealing with RA flare, you are dealing with steroid side effects, and then adding the dietary changes can be overwhelming. So try to make simple, small changes, but be consistent with those changes. And thank you all of you rheumatoid warrior for watching the video. If you like this video, please subscribe to our channel, give us a thumbs up, and always let us know what type of content do you want in the comments. That will help us understand what you truly need and what will help you better manage your arthritis and the side effects of these medications. And I'll see you in the next video. Bye-bye.